take a little time to do that. So we have two more people to speak at this point. It's important to understand that our drugs treat the cancer, but we treat individual people and their families. And obviously, when one has a diagnosis of melanoma, whether it's primary or metastatic, all of the issues that surround both with dealing with the disease, dealing with families, and the financial implications of all of these things are very important. We've built a great team of people to help us not just manage the disease, but manage the individuals that have the disease. And Dr. Fehon joined our unit some time ago as he's currently I can't even get the words out. He's currently one of assistant professor of psychiatry, and really helps us to help deal with the disease. Some people think that we asked him to join our unit because we're all crazy, but it's not the case. It's it's actually to help our patients. So with that, Dwain, please. Do we get in the wrong order?
Is that okay? Let me just get out and get in. Thank you very much for that introduction, and thank you for allowing me to be here tonight. It's an honor and pleasure to be speaking here with you. I'm going to be speaking a little bit about maintaining resilience, and I think given the hour and how many of you have stayed here already, by definition, you're all resilient. So what I'd like to do is to provide a little bit of an overview of stress management, and some of the things that we've learned about resilience and resilient people, and to provide you with some take-home messages that hopefully will be of some help. But what I'd like to do to start is just an acknowledgement. Living with cancer can certainly feel like an emotional roller coaster, one that can affect how you think, how you feel about your life, yourself, your relationships, and can challenge anyone's ability to cope. But the important thing for everyone to remember is that you're not alone. There are nearly 13.7 million people in the United States who are living with a past or current diagnosis of cancer. That is a lot of people. And add to that their spouses, their family members, their friends. Many, many people are either directly or indirectly affected by cancer in this country. Over 800,000 people in the United States are diagnosed with melanoma. And unfortunately, 76,000 new cases are expected this year. And our goal as a program is not only to provide you with the best care possible to treat your cancer, but also to provide you with the guidance and support needed to effectively manage and live with your cancer. Now, we all know it's very natural to sometimes feel stressed or overwhelmed. And your team here, they want you to know that they're concerned about your coping, and that you should always feel encouraged and welcome to let your team know, your providers know how things are going for you and what we can do to help. Now, when we're talking about resilience, it's also important to think about stress and coping in general. We're often thinking about, well, what predisposes a person to stress? What predisposes or protects a person from the adverse consequences of stress? What can enhance a person's resilience? Now, before I get into resilience, let's just present a very basic, simplistic model of stress. And in a very simplistic sense, this is what happens. An event happens in life, is perceived as stressful, that triggers certain chemical and biological changes within us, and this is what we know very well. We understand how stress hormones are released within the brain and how they're distributed throughout the body, and how they create a state of arousal and tension, that fight or flight response within us. And this can happen on a mild scale or on a very large scale within us. And this is a good thing. Stress has been helpful to us. It's what's helped us adapt and survive as a species. We know that a certain amount of stress gets us mobilized. It motivates us to act, to do things. But too much stress can have detrimental effects, right? We can get exhausted. It can lead to problems with anxiety. Can lead to burnout. And we certainly know about the negative effects that stress can have on the body. Almost every single system throughout our body can be potentially negatively affected by stress, from the immune system to your cardiovascular system to your nervous system. And that relates to depression, because depression is, well, what we think of it is a medical illness that's caused by biochemical alterations in the brain that are brought about by medical illness and emotional stress. If you're at all concerned about yourself, the possibility of being depressed or having depression, you should always let your doctor know. Depression, or clinical depression as we think of it, is characterized by a low mood or irritable mood more days than not for at least a 2-week period. Typically, it also involves a loss of interest in usual activities and is accompanied by other changes like appetite loss, inability to sleep, energy changes, no energy, apathy, or changes with how you think, guilt, worthlessness, and certainly suicidal thoughts. We also know that there are certain risk factors for depression. Stress is not the only thing. And these are important for us as providers to know, and important for all of us to understand about ourselves. What are our risk factors? If you have a prior history of anxiety or depression, you're at risk for another episode. A history of traumatic experiences, whether they're childhood experiences or other experiences that you might have had in your adult life. Social isolation is a major risk factor for depression or any adverse stress-related consequences. A history of drug or alcohol abuse or misuse. These are all things that are important for your providers to know. Hopefully you're asked about them, but if you're not, please let us know so we know how to be helpful. In addition to knowing risk factors, we're also really interested in understanding what helps people to stay resilient. And the American Psychological Association defines resilience as the process of adapting well in the face of adversity. It means bouncing back from difficult experiences. And now there's a whole science related to resilience. We are increasingly concerned with understanding the neurobiology of stress and what helps people remain resilient and healthy in the face of stress, because clearly not everyone responds to stress in the same way. Some people can be adversely affected and some not. Why is that? One of the most interesting things that we've learned recently is that changing how we think about stress can also change how our body responds to stress. So, as Dr. Schnoll said, I'm a psychologist, and I'm going to tell you a secret. Many psychologists are very preoccupied with this basic relationship, this basic triangle. It's the basis of cognitive behavioral theory and cognitive behavioral therapy, which is one of the most common and most effective forms of therapies for treating depression or anxiety. At its base is the emphasis on the connection between our thoughts, our feelings, and our behavior. How we think, the words that you use in your mind when you're talking to yourself or with your friend or your spouse, those thoughts influence how you feel. How you think and how you feel oftentimes will shape what you do, how you live, the choices you make, right? Think about it. Say it's a nice day outside, it's beautiful, it's a nice morning, you look outside and you see the blue sky, you hear the birds chirping, and you think to yourself, wow, what a beautiful day. That thought helps produce a pleasant feeling, a positive feeling. That thought and feeling might lead you to go take a walk, make a nice breakfast, hug your spouse. This connection between our thoughts and feelings and behavior is very important. Because when we study resilient people, when we interview resilient people and understand what are the common traits, what are the common factors of people who are resilient, we find certain things that relate to thoughts, feelings, and behavior. And what I'd like to do is just to point out 4 of the most common traits among resilient people that we've found in our research. The first factor or trait is this capacity to maintain a positive attitude, optimism, hope, right? The capacity to have hope for yourself, a positive feeling for others, and a general belief that things will be okay. Despite the outcome, belief in yourself that you will be okay. Factor number 2 is tenacity. Resilient people tend to be tenacious. They don't give up. No matter what the adversity is, the stressor is, they find a way to keep going. Factor number 3 relates to social relationships. Resilient people stay connected. This is very important. Relationships provide us with support, love, affection, decrease our sense of isolation. Some of these factors are speaking to that connection between thoughts, feelings, behavior, right? The ability to be with each other, that speaks to behavior. Tenacity, that also speaks to behavior, not giving up. Optimism speaks to thinking, the way we think. The 4th major factor among resilient people is faith and spirituality. Resilient people have an important connection with faith. And this could be of traditional faith, sources of faith, whether it be religion or more non-traditional views and conceptualizations of faith and spirituality, but a belief in that there's something greater than yourself. A personal connection, whether it be to God or the universe or to all things and people, but that sense of faith. So in resilient people, we tend to find these factors: tenacity, optimism, the ability to be connected, and faith. Well, these all sound great, don't they? To one extent or another, we're all capable of having some of these qualities. But when stressed, when you're not feeling well, when facing surgical procedures or medications or treatments that can affect your energy, that can affect your mood, it's often hard to stay resilient. So when we think about ways to increase resilience or maintain resilience, oftentimes we're thinking about ways to manage stress. And when I meet with folks, I'm always reminding them to remember their ABCs when it comes to stress management. And I like to leave you with a few basic tips, take-home tips. Going back to that model of stress, we know that environmental stressors, internal stressors, they create that biological response within us that increases our physical arousal. It creates a sense of tension that helps us, that mobilizes us. Well, that tension built up over time contributes to our experience of stress. Oftentimes in life, we're not even aware of our own stress level. We're too busy, we're preoccupied, we're not in tune with the tension in our back, that knot in your stomach. So the first step in managing stress is understanding your own physical or mental signs and symptoms of tension. Once you're aware of it, stop, breathe, pause. Breathe to relax your muscles, to calm your thoughts. You can't be tense and relaxed at the same time. Once you're relaxed, that gives you a place to make better choices, to think about how you want to cope. And oftentimes in stressful situations, there are things that are in your control, aspects of that stressor that you can actually control, and there are aspects of a stressor that are beyond your control, right? And so that's important to know. We want to know what's in your control and what's not, because that helps you to know how to best cope. If something's in your control, if you can fix a problem, you're better off fixing it, right? It only makes sense. That's what we think of as problem-focused coping strategies. But if something's not in your control, you can't fix it. It's beyond your control. But the next best thing you can do is change how you think about that problem. And that relates to these emotion-focused coping strategies. Rethinking the situation, reframing your thoughts. Changing how you think can change how you feel. Exercising, meditation, prayer. These are behaviors that can change how you think, right? Think about it. When you take a walk, when you exercise, it clears your head. It helps you to feel better. And that's part of a healthy lifestyle. Tip number 3. This is a list of some basic, helpful strategies for maintaining a healthy lifestyle. The first few are probably things that your mother or father told you when you were a little child, right? Eat well, eat your fruits and vegetables, play outside, and get plenty of sleep. Sleep is so important. The next relate to connection. Make time with friends and family. Accept help from others. You don't have to do everything on your own. The next 3 in the list relate to how we think. When under stress, we're all vulnerable to having certain very common but not very helpful ways of thinking. We tend to assume the worst. We might jump to conclusions. We might be more likely to think in all or nothing terms. This is very common for all of us whenever we're under extreme stress. But they're thoughts. And you can change your thoughts. That is something that's in your control. You can counter negative and unhelpful thoughts with more realistic or helpful ideas. You can problem solve the things that are in your control and find ways to have faith or acceptance of things that are out of your control. And finally, doing something for others is another way to manage your own stress and to maintain your own resilience because it feels good. And one final point that I'd like to leave you with just relates to meaning and purpose. As we've said at the beginning, living with cancer can feel like an emotional roller coaster. At times, it can feel all-consuming. But the important thing to remember is that there's more to you. There's more to your life. Melanoma, any type of cancer, it's significant, it's real. But there are many other significant and real aspects of your life. You may be a mother, a father, a friend, a spouse. You may have hobbies, interests. You may have goals, things you want to do. Living with cancer means living with cancer. It means maintaining a sense of optimism. It means being tenacious and going for what you want. It means staying connected. It means having faith. I hope that these tips are helpful. I hope these ideas are helpful reminders. And that through the help that you're getting tonight, through thinking about some of these basic ideas, that they help you to live your life in a way that's consistent with your values and principles. And that's what brings the quality of life. And thank you for letting me talk tonight.